Moral right to health care. HCA 322, Week 5 discussion. Distribution of wealth should not mirror the distribution of health care. Is this the question raised in Dan Bustillo's Healthcare Ethics and Medical Law? Is there a moral right to health care? As a compliance officer of this hospital, I answer to you, the board of directors, with a resounding yes. By using these elements: medical malpractice, patient empowerment, cultural competency, Stark Law, and resource allocation. I'll explain why every patient has a moral right to health care. Medical malpractice and patient empowerment. Moral is defined as being concerned with right and wrong. Rights are defined as entitlements. Patients are entitled to receive the right care, as we as healthcare institutions are legally bound to do what is right to bring positive health outcomes. We must respect the rights and empowerment of our patients while forging a relationship of trust and concern for their overall well-being. This is their right and our responsibility. The Patient Safety and Quality Improvement Act of 2005 is one of the many laws that govern and assess the right and safe treatment of patients. We are also bound by law and ethical integrity to report and repair any intentional or unintentional errors we make. Cultural competency. Money should never determine medical care. Socioeconomic factors that affect health outcomes of many of our patients. Healthcare may not be the priority of a homeless individual, but it must be ours from the moment they enter our doors. We must focus to break down the language, literacy, and cultural barriers that block access to healthcare and lead to health inequalities. We cannot be among those who neglect to serve these underserved among us. We must follow the guidelines established by class standards and, when necessary, go beyond them. Stark Law and resource allocation. As the board of directors, it's your job to maintain the viability of this hospital. We must be careful for when we are maintaining this hospital that we do not forget to manage the care of our patients. We are bound by laws, such as the Stark Law, to be ethical in our decision-making and investments. We can establish partnerships with agencies to reduce costs, but they must never cross the lines of fraud. In conclusion, my team and I hold compliance at the highest standard. Our beliefs mirror those of the OIG. Compliance is like a seatbelt. You hope you never have to use it, but you should always wear it, and it's the law.